It is top of the hour and it's time for Making a Difference. I am your host, CJ Metcalfe. On this program, we like to interview people in the community that are making a difference in other people's lives. And I'm very proud to bring this program to you. This show is sponsored by the Gulf Theater at the Military Heritage Museum. And by the way, they have put out their new schedule for next fall, and I hear the tickets are going like crazy. So if you want to get your seat for a particular show, jump in there now. Well, my guest today is Dr. Chris Constance, and he is a plastic surgeon here in Charlotte County. And I had a encounter with him and have been very pleased. I've heard many positive comments about his work. So, Chris, come on in the room and let's get talking about this and what you do.
Well, thank you,
Hi there.
CJ. Hey, how are you? Thank you so much for having me on the show and giving me this opportunity. And I just want to take a minute to really recognize all the work you do at the Military Heritage Museum. I think it's such an asset to our community, and I've been involved in some of the functions there, and it's always just an honor to be able to participate and recognize our veterans, their sacrifices through the years, and how much of a big part of our local citizenry they make up. So it's great living here in Charlotte County and spending time. But I've really enjoyed working with you. Let's just put it that way.
Well, all my encounters with you have been, I think the first time I really did a one on one with you is we were getting ready for a parade and
Right.
you were helping me decorate my vehicle, and you got your hands in there and they got dirty, and it was quite the fiasco. And I thought, well, who is that guy? And I went home and I looked it up. And when I found out you're a surgeon, I was like, oh my God, he got his hands all yucky and everything.
Well, but
And
we had to make sure that your float looked right, and it turned out great. So I was really happy to help. It was a real privilege to help you.
again, thank you for that.
My pleasure.
Okay, Dr. Constance, plastic surgery.
Yes,
How
ma'am.
many plastic surgeons are there in Charlotte County, roughly?
Well, in Charlotte County proper, there are only two board certified plastic surgeons, myself and Dr. Brody, who I think has been here probably about 10 or 15 years longer. And he's sort of, moving on. I don't think he's working as hard these days. So I'm kind of it for now. And I've done my time. I've attended the emergency rooms. I did it for over 15 years, and took care of the dog bites and the car accidents. And to be honest, even though I'm not on call officially anymore, I have so many friends that are emergency room physicians that know when they get a really difficult case, they call me, and if I'm available, I try to come in because they take, sometimes hours to reconstruct, and they just can't give up that amount of time. They would not see 20 patients in the time it takes me to do one of these difficult reconstructions. So, I'm happy to help, and I've done so for many years, but now we're doing a lot more of the cosmetic surgery. We still do a lot of skin cancer reconstructions, breast reconstructions, just, some wound care. I enjoy the fact that I have a general practice because I never know what's going to come through the door. And my main mission has always been to help people.
Well, that was going to be one of my questions is like, what are some of the procedures that you specialize in? And go ahead and repeat them
Sure.
if necessary.
Yeah. So, well, I have probably for the last 20 years become very specialized in doing laser work. So I have lasers that I bring into the office monthly. We remove age spots, vascular birthmarks, tattoos, hair removal, wrinkles. We do a lot of work with wrinkles, especially a lot of ladies will come in and say, I don't like what sun damage has done to my face. And I agree. Yeah, there's a lot of issues. If the skin is loose, you've got to do a skin tightening operation, like a facelift, like eyelid surgery, like a brow lift. But if the character of the skin is very wrinkled, like parchment paper, and it's the surface that we're trying to essentially resurface. Then the best tool for that is laser, either CO2 or erbium, because then you're working on the area generally around the mouth or sometimes around the eyes, but areas where pulling is not going to help the surface of the skin. You really want to do something to resurface. And so the way I like to explain it to most people and patients is I'm a board certified plastic surgeon. I've been president of the Florida Society of Plastic Surgeons. I've been recertified twice. I'm continually certified. I'm a top doctor since 2004. I found out on the website it's actually 2004, not 2009. So that you can't buy that. That's recognition by your peers and your patients as being the best of the best anywhere in the country. So with that recognition, understand I have every tool in my toolbox. So if somebody goes to the dentist and gets Botox or fillers, they are kind of stuck because that's all they do. But if somebody comes to see me and, the first question I ask is, what are you unhappy with? Not what procedure are you here for? Because I think it's part of an educational back and forth with the patient. And my job is to educate. My job is to hear the concerns. What are the deformities of aging that you're trying to correct? And I have everything at my disposal. So whatever it is that you want to get done, I will give you your best options. And I will tell you something, it's not uncommon that somebody comes in and is wanting to do something that really can't be done. And I really try to talk them out of it. I say, listen, with my experience, what you're going to pay for that is not going to get you the benefit that you're looking for. And honestly, don't go other places because people will take your money and then you'll just have less money and be unhappy. So I really try to work with folks to give them my honest assessment of what will benefit them and what won't benefit them, and give them all the different price levels so that they have lots of options. And that's what you get with a board certified plastic surgeon that does everything versus somebody that just has one or two techniques at their disposal. They're really not fully trained. And it's the old thing, they have a hammer. So everybody that walks in is going to become a nail no matter what. Well, I have the whole toolbox. So if there's something in particular you need, chances are that I do it. And I've been doing this for, 30 years now, between training and, I hate to say it, but a long time. So I know how to stay out of trouble and I know how to get people great results.
You said something that just totally got to my heart, and that is you're not a money grabber. You're not
No.
surgery happy. I mean, if you can't help the people, you're up front and honest about them. I have seen so many botched jobs, and that, I in my mind it was a plastic surgeon who was after the money and knew that it wasn't going to turn out good. You also said something that hit a button with me, and I want to talk about this. Age spots. I always thought that was a dermatology, but what can a plastic surgeon do for age spots? Oh, okay, we're having a little technical problem here. Dr.
Right.
Constance
Well,
froze. He's still freezing. Put a jacket on.
yeah, I'm here. Can you hear me?
Yes, I can.
There we go.
Okay, a little bit more
I think
technical
we're back.
problem.
Now you're frozen. Now you can hear me.
Yes, I can.
Most dermatologists will use liquid nitrogen. Are we back on?
Okay, liquid nitrogen, that's like a freezing process on age spots?
Right. So exact. Yeah. So what they do is they will freeze off the spots, and it works. But the problem is you can't judge the depth. And so what generally happens is they'll go too deep and leave these little white scars everywhere. I use laser. You can use chemical peels. You can use other modalities. But with the laser, I'm targeting the pigment. So the only thing the energy affects is the pigment I'm trying to remove. And it's really magical. I mean, it's something that I stumbled upon 20 years ago in deciding, you know what, this laser technology really has something going for it. And it was after I trained, but I studied a lot and went to a lot of shows and saw the product.
Okay, again, another little sound glitch here. Oh, we're having some challenging technical issues, but I'm going to keep going because I want to hear what he has to say. I've got my tech working in the background to see if there's any solutions.
Yeah, it's on Chris's end. I mean, actually, I don't have makeup on. It's on Chris's end. Go ahead and I can edit some of this out.
Okay,
So, okay, so you get so our audience does get the whole gambit. And what I'll do is if Chris can hear us, I'll kick him out of the room and have him come back in because he is frozen in the background. Even
okay,
though you can hear him off and on. Um, in case, and I can call them if need be. Okay.
okay. Well, to continue on, the business about the age spots, I mean, I don't know about anybody else, but at 67, I have a few, and they they seem to be getting bigger. I don't know about that, but I don't want them. They're in places that show. And my next question to Dr. Constance is going to be, okay, so how much does it cost to get one spot removed? That's going to be my next question to him.
Hey, CJ, I'm back. How are you?
Hi there.
Sorry about that. So I heard your question, and it really depends. I mean, I don't charge for a spot because most people don't have a single spot. They've got a number of spots. So it really depends on the consultation. Is it your hands? Is it your arms? Is it your face? Your neck? We kind of go over and I kind of in my mind try to figure out how much time is it going to take me. So it may be anywhere from $200 to $500 per session, depending on what we're getting done. Is it a lot of blood vessels? Sometimes people have little tiny red blood vessels around the nose, on the cheeks. That comes from sun damage, sometimes on the upper decolletage area or the neck. So we assess exactly what the issue is for the patient, and then make a treatment plan for them that's acceptable. Even leg veins, the little tiny leg veins, I used to do injections with a high salt solution. Now I just use the laser, and it works incredibly well.
Really?
Yeah,
I think they commonly call them spider veins.
spider veins, exactly. And
Right.
and
Can you
so
do something with the varicose?
in general, if the varicosities are bad enough, they need to be stripped. So yeah, they can be surgically removed, and I've certainly done that, where you try to minimize the number of incisions that you do, but
Mm.
it's pretty involved. You have to make a commitment to strip out the veins. Sometimes it's just one little area, but that comes from valvular incompetence, and so a lot of times it's happening deeper inside the leg, and the perforator that goes to the surface, that's why you have that back pressure, and it balloons out those little spider veins on the surface.
Well, I would imagine I'm most of your patients are going to be women. Is that a correct statement? I
The
want.
majority of my cosmetic surgery patients are definitely women. I do see some patients for skin cancer reconstructions, and so it's more 50-50. But for the face, in this area, the population is a bit older. So I do a lot of skin tightening procedures: facelift, eyelids, brow lift, neck lift, um, breast lifts, upper arm tightening, thigh plasty, tummy tucks. There's a lot of the people have lost weight, or things are loose and they want to get them tightened up. And so the trick is to pick optimal candidates, give them the right procedure, coach them before, basically during and after the procedure, so that they're all doing the right things with nutrition, vitamins, extra vitamin A, vitamin C, so they heal right. And the other thing is, patients I don't know how other guys do it, but I see you the next day after surgery. I usually see you once or twice within a week, every week for a while, then every 2 weeks. I mean, I really don't let go. I want to make sure that I'm seeing you through that whole post-operative process because you as a patient, you've never done this before. I've done this a lot. I know what to expect and I know how to avoid situations that could lead to complications just by doing the right thing by the patient and doing that communication side of it. Most issues occur because of a lack of communication. So I'm always answering the patient. And by the way, all of my cosmetic surgery patients get my cell phone number. I don't have them go through a service. I just tell them, here's the number. Any questions, just call me. Because then I know there's no barrier. And I expect them to call and there's no excuse. So it works great. I mean, 5 minutes I'm on the phone, we give them the guidance and everything's great. Everybody's happy.
That is wonderful. Oh my gosh. What what a doctor. What a doctor. Excuse me, I've got some stuff going on here in the background's making noise. Um okay. So, I mean, I heard that through the grapevine that there was a gentleman who, I guess through an accident, pretty much had his ear destroyed, and you were able to go in and
Sure.
reconstruct it. What was the most challenging part of that surgery?
Well, the hallmarks to doing a perfect or excellent reconstruction are number one, identifying all the pieces. It's just a big jigsaw puzzle. Knowing the mechanism of injury and the level of contamination, making sure that we spend lots of time cleaning because the biggest problem is I see when patients get fixed other places is they don't clean them appropriately. Then I get a wound that's been sort of put back together and is dirty, infected. I've got to wash it all out again, put it back together. So if you get it really clean on the front end, get that cartilage framework of the ear back together anatomically, and then close the skin with dressing it the right way, making sure there aren't antibiotics, all the principles, good nutrition. Patients generally tend to do very, very well. It's when you're not following those proper principles and you're not taking the time. It really is it's a time commitment to doing a good reconstruction, whether it's a breast reconstruction or traumatic reconstruction or hand surgery. And I do some hand surgeries as well. So get knowing the anatomy, getting everything back together, and then the post-operative course, following them,
Mhm.
seeing them right away, keeping them out of trouble, all very,
Right,
very important.
right. Wow. Well, I also, not only are you a board certified MD, boy, my house is going off.
Hey, look, I'm just glad it's not on my end, CJ.
No, it's uh, please pardon me for my background noises, but
No problem.
um, okay, um, Dr. Constance, you are a man also in the community. Not only are you a successful and well-known plastic surgeon, but you're also active in the community. And as I know it, you are honorable Christopher Constance as a county commissioner on the board with the county commission, and you're on
Yes,
some.
ma'am.
How long have
It's
you
been
been
an
there?
honor. It's been an honor and a privilege to serve Charlotte County since 2010. I was given my new first name of honorable, which is still very hard to accept, but I work very hard every day to make sure that we do right by the taxpayers and the ratepayers. And, it's part of living here and wanting to give back. I'm too old to serve in the military and really do my part. My hat is off to all the veterans because I think they're the ones that really put their lives on the line. And of course, our first responders. But, if I can do things to support those individuals, then I feel like I can, in some small way, help out and do the best I can for all of us.
Just in talking to you, you seem very honest, very sincere, and I truthfully can't imagine anybody else that I would want sitting on the board of commissioners than you. I
Well, thank you.
believe what you're saying, that you're there for the taxpayers. You're there listening to them, and you want to do right by them. So because I mean I'm I, I'll probably get in trouble for saying this, but with a plastic surgeon's salary, I doubt if you're on the commissioner's board for the money.
No, I'm definitely not interested in any kind of extracurricular activities. Those things are just not on my radar. But I will tell you this: I've given up a fair amount of income, sacrificing my time as a doctor to work on the commission, and I think it's just the right thing to do. It's not all about how many zeros are in the bank account. It's how nice is your community, what can you do
Right,
responsibly to
right.
give back. And even healthcare, I really kind of keep a watch on all these hospitals to make sure we're providing as good a healthcare to the citizens as we can, because we've that's our mission. We've got to make sure this is a great place to live, work, and play, and health, welfare, and safety. That's what we're charged with. So
Well, I think also you serve on the board of some local hospitals, which that wouldn't surprise me that you do that. I mean, what else do you do? You're a philanthropist, which I appreciate. And okay, so I know you'll sit on the parking lot pavement and talk to somebody. I
well,
couldn't.
CJ, I will tell you this. Yeah, I just finished in the beginning of January, handed the reins at the Punta Gorda Hospital. I was chief of staff for the second time, but I still get involved in the different medical staffs because I just want to make sure I know what's going on. And if there's anything that I can do to help, I want to know ahead of time. But my other real guilty pleasure, and your producer Marie Labrosse is part of this, is she started Comedy for a Cause for the Charlotte Players, and so I get to direct an improv show every year to raise money for that theater group, and it's such a phenomenal cause. It's such a great group, and so again, a real guilty pleasure. I'm very honored and lucky, so lucky that that I kind of fell into it at first as one of her cast members the first year, and now we're at like 10 years. It's just amazing that we've paved the parking lot, put the theater in, put air conditioning in the building. I mean, every year we're able to add assets little by little to make that little theater, that Helen Langdon Theater, just a jewel. And Marie, I got to tell you, she really deserves all the credit for getting it off the ground, selecting a great director, and then moving the process. And so it was easy for me to step in and help out. And it's a lot of fun. It really is.
Well, Dr. Constance, I cannot thank you enough for coming on and enlightening me and the audience
No, thank
on the field of plastic surgery. I have learned quite a bit today. And as a man in our community, you truly are making a difference for our community. And I appreciate you more than you know. And thank you. And I think I'm going to have you back on. You're very interesting.
Well,
You got a
thank you,
lot
CJ.
of things in your
I'm
bag
I'm happy
there.
to I'm happy to come back. It's been a real pleasure spending time with you. And if anybody's interested and wants to look more into my abilities as a plastic surgeon, the website is chrisconstance.com, and my office number is 941 New Look. So please take advantage and give us a call. We're happy to help you.
Yeah. Okay, well, I hope you all enjoyed today's program. I certainly did. And know that you can see me every week, every Thursday at 10 o'clock, right here on WKDW 97.5 FM. This is CJ Metcalfe saying, I will see